Here's the $1,000,000 question, $1,000,000 pounds, $1,000,000 euro, whichever currency you choose. Question: why is cellulite so difficult to treat? Well, the short and brief answer is that it's a complex problem. It's not just one thing problem that you can just treat like dissolving the fat. No. And there are multiple factors that contribute to its appearance. So let me break them down into the main three ones. Number one, hormones. Well, it makes sense because, as I just said, affects mainly women. So that's telling you that hormones do play a role here. Big role, in fact. They regulate fat storage and circulation in the skin, and this is true to this point that in the very few cases where males have cellulite, which yes, it may happen, is normally or almost always when there are hormonal imbalances happening on those men. So, these hormones, particularly estrogen, play an important role during the puberty and also during menopause, where all these levels are constantly changing. Number two, the connective tissue, and more specifically, I will say the extracellular matrix. And the extracellular matrix is the atmosphere where the cells live in, and is related to the connective tissue because the collagen fibers, the elastin fibers, live there, but also to all the components that are there. If we go back to the mattress analogy, these will be like the springs, that these different structures that are within the cells that may produce the so-called cellulite. In the case of women, these fibrotic septa are located parallel and then perpendicular to the skin. So when the fibrotic effect happens, they will be easier to tether the skin down and produce the dimples. Whereas in male, they are crossed like this. So connective tissue and the anatomical differences and the gender difference play a role here. Number three, which is forgotten in many cases, lifestyle and metabolic factors. Circulatory problems, low-grade inflammation, which is called the metabolic syndrome, sedentary lifestyle, bad nutrition, all these factors play a role. And by modifying these factors, we will also produce better results. And let me tell you, there's one that is mostly forgotten all the time, which is stress. And I know stress is a common thing among, particularly the Western world. And sometimes we don't think about that, but the reality is when stress, there's a lot of catecholamines in the bloodstream. And these catecholamines, as you probably know, play an important role in the metabolism of fat and fat tissue. So by just reducing the stress levels, you will be surprised the big impact that you may produce in your patients. So it's not just about having the magic tool, the magic wand to treat them, but also to understand these three key contributor factors. So you see what I meant before? It's no wonder that so many patients are frustrated when they just try topical creams or shiny gadgets, trendy gadgets with little or no results. And we as aesthetic practitioners need to offer solutions to address these, very important cosmetic problem for our ladies, for our lovely patients. If you're already prepared and ready to take your cellulite knowledge to the next level, consider adding injectables like Alidya. I briefly mentioned Alidya at the beginning. Is the world's first class 3 medical device specifically designed to treat cellulite, grade 1, grade 2, and this will position you as a leader, a forward thinking in your space. And if you want to learn more about Alidya and how to implement it into your clinic, check the link in the description down below, and I'll be happy to help you in your journey. In this particular occasion, I can help you to cover all the signs, the cellulite, the different approaches, and the technique, and how you can implement successfully this new treatment into your clinic. Don't forget to like, subscribe, and hit the notification bell for more videos that are helping you to grow your clinical practice. And until the next video, thank you very much for watching.